What exercise really does to your bone density? Well, I gasped when I read this. A high-profile fitness person posted this from one of their members. I gained 30% bone density just following your program. 30%. Hi, I'm Dr. Lisa. I'm a physical therapist and an expert in osteoporosis and bone health exercise. And I need you to understand why that claim concerned me so much. And I want to help you critically examine posts like this so you can make the best decision for your bone health. Here's the problem with big claims. And honestly, I'm willing to bet that they just didn't know. But this is about what happens when excitement outpaces evidence. What this is about is what we all see happening in the bone health online spaces. Big, bold numbers posted as testimonials shared by well-meaning people, and they're spread to hundreds of thousands of women who are scared and looking for hope. These women deserve accurate information. So let me break down exactly why 30% gains should be a red flag for you. Consider this. During the menopause transition, most women lose somewhere between 10 and 20% of their bone density. That's loss that happens over years, driven by estrogen decline. So when somebody claims a 30% gain from an exercise program in a year, it's a number that doesn't really line up with how bone biology actually works. Here's why this matters. The expectations were not based in reality or science. It's a false promise. And when you expect 30% and you get 2, you think you failed and you think the program failed. So you quit. And quitting is the one thing that will absolutely not help your bones. So let's talk about what real clinical trial evidence actually says. The real numbers are meaningful. They're just not magic. Exercise alone. So let's look at just what exercise can do. The best studies on resistance and impact training in postmenopausal women show improvements at the lumbar spine in the range of 1 to 3% per year, with smaller, more variable results at the hip. The LIFTMOR trial, one of the most rigorous studies we have, used high-intensity resistance and impact training twice a week for 8 months. The results at the lumbar spine? About 2.9% improvement compared to the control group. And at the femoral neck, about 0.3%. And that result, it's not an outlier. We have a 2025 meta-analysis covering 17 randomized control trials with nearly 700 women that confirms resistance training consistently and significantly improves bone mineral density at the lumbar spine, femoral neck, and total hip. This effect held up across multiple studies, and that matters. This means that LIFTMOR wasn't one lucky trial. It's a repeatable, real result. But what those trials don't show is anywhere near 30%. Now, most women following a well-designed bone health specific program will land somewhere in the range of 1 to 3% per year at the lumbar spine. What that actually means for your skeleton, even a 2% improvement at the lumbar spine density can meaningfully shift fracture risk. It's not just the number, it's a structural change in bone tissue. 2% is a win. Well, what is the effect of menopause hormone therapy? How does that affect bone density? Studies show menopausal hormone therapy can produce gains of 3 to 6% at the spine and hip over 2 to 3 years. It also reduces fracture risk by 20 to 40% across all sites. But the timing of this really matters. The closer to menopause when you start, the stronger the bone protective effect. And for those who can't take it, like breast cancer survivors, you're not without hope. The research still supports exercise and nutrition to help protect you. A 2025 meta-analysis found that exercise combined with calcium and vitamin D supplementation significantly improved bone mineral density at the lumbar spine and femoral neck compared to supplementation alone. And these aren't dramatic numbers, but they do compound over time. What do medications deliver for bone density changes? And I share this to give you the context for this claim. What does medication do to bone density as we look at that compared to exercise? Well, osteoporosis medications, when indicated, can be a powerful tool. Denosumab, studied in the landmark Freedom trial, produced approximately 9% improvements at the lumbar spine and 6% at the hip over 3 years. Bisphosphonates typically deliver improvements in the 2 to 5% range, depending on the site and the duration of treatment. And then there's a separate class entirely of anabolic agents. Evenity is one of them, and it works by both stimulating bone formation and reducing bone resorption. So in the Arch and Frame trials, Evenity produced lumbar spine gains of around 13% in 12 months. So here's what I want you to think about. The most powerful drug class we have in a tightly controlled clinical trial gets 13%. So when somebody posts that they gain 30% from an exercise program, I need you to sit with this number now with what you've just learned. Where does that number come from? Because it doesn't come from the research. Fracture risk now is not one variable. It's the product of your bone density, your bone quality, your balance, your reaction time, and the forces you put on your skeleton every single day. A well-designed exercise program addresses almost all of those. And that's why exercise is non-negotiable. It's not optional support for other interventions. It's the foundation. How do you spot red flags? At least, how do you look at things critically so that you can consider the information more closely? Because the internet is not going to get any less confusing. Red flag number one, a testimonial that's presented as evidence. Red flag number two, no citations, no studies, no trial names, or no clinical guidelines. Enthusiasm is not a source. Red flag number three, the claim far exceeds what clinical trials show. We have decades of rigorous research, and when a claim is 10 times higher than what that controlled trial produced, that should make you pause. Red flag number four, before and after DEXA scans without context. A 2 to 3% change can be within the margin of error for a DEXA. So when someone's claiming 30% from one scan to the next, that's not a bone density improvement, that's a data problem. When you're evaluating who to trust, ask yourself this. Does this professional have training and expertise to work with people who have osteoporosis? And do they understand the research behind it so that they can explain it to you, the what and the why to what they're educating you with? For reliable information, I like the Bone Health and Osteoporosis Foundation and Osteoporosis Canada. Both publish evidence-based guidelines that are regularly updated. And the Bone Health and Exercise Science Lab at the University of Waterloo in Canada continues to produce and assess bone health exercise research. I also try to be that resource for you. Every program I build, every claim I make, I can point you to the study or the guideline behind it. That's just what evidence-based practice means. Slowing bone loss and reducing fracture risk by a third, that's life-changing. That's a hip that doesn't break, and that's independence in our 70s, 80s, and 90s. Don't chase exaggerated numbers. Chase consistency. Chase progressive overload. Chase adequate protein, calcium, and vitamin D. That's what changes outcomes. If you want to see exactly what evidence-based bone health training looks like, the guidelines, the load progressions, the research behind each element, I have a workshop. It's called Journey to Fracture Proof. It walks you through the science and shows you how the Brickhouse Bones method can be applied to every level of ability. Whether you're newly diagnosed with osteopenia, managing osteoporosis, or just trying to get ahead of bone loss before it starts, there's a path here for you. Links on the program are in the description. If you like this video, save it. Share it with someone who needs to hear realistic expectations, not false hope.